Ready to jump in? Okay. Perfect. Well, thank you very much, everyone, for dialing in today. On behalf of Premier Kenney and Alberta's government, I'm pleased to welcome you to today's important announcement. Joining us today are Jennifer McHugh from the Alberta Continuing Care Association, or the ACCA. Thank you very much, Jennifer, for joining us here today. And as well, John Kopek from the Christian Health Association of Alberta, or the CHAA. Thank you very much, John, for joining us here today. We're all here today to talk about supporting the expansion of continuing care spaces in the province. Now, it's no secret that Alberta's seniors population is growing. Too many Albertans are waiting in acute care or in the community for continuing care spaces to become available to them. As individuals, we all want to live near our family and near our friends. We want to be part of a community and to have a sense of belonging. As we age, maintaining a sense of community becomes an increasingly important part of our lives. So I'll now turn over the podium to Premier Kenney to make today's announcement. Premier?
Thanks very much, Tyler, and to Jennifer and John for joining us for this important announcement about creating more continuing care spaces for Alberta seniors. I'm pleased to be here with Minister Shandro and representatives of groups that provide continuing care to tens of thousands of Alberta seniors for this announcement about creating more spaces to meet the rising demand for seniors' care, particularly care that is COVID-safe and high-quality continuing care. Alberta is the youngest province in Canada with an average age of just 37. That's about 4 years younger than the national average across Canada. But as in all the other provinces, despite our relatively high birth rate and relatively strong levels of migration to Alberta, our population is, of course, getting older. Our current population of nearly 4.5 million includes nearly 600,000 people over the age of 65. And by the year 2046, projections are that our total population will grow by about a third to 6.3 million, while our seniors population will double to 1.2 million. Now, we are fortunate to live in a society that places great emphasis on care for the elderly, and that's something that it goes way back in our history to First Nations culture, and indeed some of the member organizations of the Christian Health Association of Alberta started providing care to people here in the mid-1800s, long before we became a province. Today, there are some 27,000 continuing care spaces in Alberta, about 16,000 long-term care, and 11,000 designated supported living beds available in Alberta. The system is a pretty equal mix between private, nonprofit, and community voluntary providers. They're funded on equitable terms based on the needs of clients. All have to meet the same standards, and they offer a wide variety of choices to families. This stimulates healthy competition and innovation and high performance compared to many other provinces. The COVID pandemic has really been revealing in this way. The virus has been particularly dangerous for the very elderly, of course, especially for those with underlying health issues living in long-term care facilities. Alberta has not been spared from lethal outbreaks in senior homes. Tragically, in fact, they have accounted for over 2/3 of our COVID-19 fatalities over the past 6 months, and the average age of those we have lost is 87. But early on, Alberta's government, Alberta Health Services, and our continuing care operators recognized the risk to seniors, and so together we took action to address it. Those actions included restricting staff from working at multiple seniors' sites, strict testing, cleaning and personal protection equipment requirements, and enhanced visitor restrictions. We boosted funding by more than $260 million, $250 million this year, to increase staff and strengthen protections for clients in continuing care facilities and lodges. These efforts and investments, coupled with the inherent strengths of Alberta's continuing care system, have kept our infection and fatality rates relatively low in seniors' homes, especially compared, for example, to Ontario and Quebec, to many U.S. states, European countries, etc. COVID mortality rates, for example, amongst senior homes, have been 9 times higher in Quebec than here in Alberta, and 3 times higher in Ontario than in our province. That is a huge difference. And we were never even close to having to call in the Army to help us to staff seniors' facilities, continuing care facilities, like those central Canadian provinces did. But we acknowledge that no system is perfect, and we must always do better. And in fact, we were elected last year on a commitment to expand and improve on Alberta's continuing care system by cutting wait times that had grown ridiculously long under the previous government. That was partly because of the previous government's ideological bias towards state-run monopolies in the provision of public services. But our government has a different bias. Our bias is towards patients, towards people, in this case, towards seniors. And that's why we support a diversity of operators and choice in the provision of those services. It's why we are creating more, better, and safer continuing care spaces for Alberta's seniors. And that is why I am very happy today to announce that Alberta's government is launching a plan to create hundreds of new spaces in the communities across Alberta that need them most, a plan that will enable thousands of current and future seniors and other Albertans to access safe, high-quality continuing care in the communities that they call home. Today, we're opening up a new and innovative bidding process that will create hundreds of new spaces without requiring new capital investment, a critical issue during these challenging economic times. Through extensive consultation with public, private, and charitable operators, we've identified a lot of underutilized space in existing buildings and the capacity to add hundreds of new publicly funded spaces to those facilities. To add these spaces as quickly as possible and as cost-effectively as possible, we're delivering on our campaign promise to revive key elements of the Affordable Supportive Living Initiative, also known as ASLI, that was undermined by the previous government. This will allow, for example, the operator of a supportive living facility to develop new publicly funded continuing care beds in a currently underutilized building. This will speed the addition of capacity to the continuing care system without waiting years to construct a new building. But we will be constructing new buildings, and an announcement will be coming about that later in the year. Alberta Health Services is posting a request for expressions of interest targeted at specific priority communities, and there's a list that we're releasing here today, where we know there is a serious need for more continuing care spaces. And many of these are smaller communities in rural Alberta where seniors quite rightly want to be able to age in the communities where they've lived all or most of their lives. This expression of interest is open to all organizations in those priority communities, including nonprofit and commercial providers. Operators located in priority communities are invited to apply right now, immediately, if they have space which can be converted to new publicly funded spaces under contract with Alberta Health Services. This includes operators in Alberta's Indigenous communities who want more options for continuing care. And I've been able to visit some of the great long-term care facilities on reserves operated by First Nations. So once this expression of interest is completed and we have contracted additional spaces, we will then examine the gaps and plan for additional expansion of continuing care spaces in the area that needs it most. And as I said, we'll have more to announce about that later this year. All the spaces created will conform to the lessons learned about how to protect the most vulnerable during the pandemic. And should there be a future pandemic of this nature, the same lessons will apply. These include the clearly higher risk of infection spread in facilities that have shared rooms and less space, common space for activities. Since 1999, Alberta's capital grants program for continuing care have required that all new spaces are in single private rooms, with some exception for couples, plus increased space in buildings overall. This is likely one of the reasons that Ontario and Quebec endured significantly higher rates of transmission in their continuing care facilities, where there are more shared rooms and, frankly, an older housing stock. In addition, since the onset of COVID-19, new architectural design requirements have been developed by Alberta Health and AHS. These will be used in the current request for expressions of interest to create new spaces, as well as in subsequent capital grant competitions. And I should point out that successful those organizations that achieve contracts with AHS under this program that we're announcing today will obviously be spending money, their own money, not taxpayers' dollars, to upgrade and retrofit existing spaces that will help to create jobs right now in the COVID recession. So all of this, the request for expressions of interest it incorporates a number of lessons learned from the COVID experience in continuing care facilities. These include features like separate entrances for staff to enable monitoring, increased internet access for telehealth and resident use, and smaller residential care settings of 14 to 18 people to limit exposure and facilitate isolation. In total, over the next 3 years, Alberta's government is investing $164 million in capital funding alone to develop more and safer continuing care spaces across the province, and as I say, this will help to create thousands of jobs. We're fulfilling our commitment to treat seniors and vulnerable Albertans with the support and respect that they deserve by investing in the care that they need in the communities that need it most. Thank you again to everyone at AHS, Alberta Health, to Minister Shandro, and all of those involved in our continuing care system for the great efforts that you have made and the extraordinary compassion that has been shown throughout Alberta's worst public health crisis in a century. Life goes on, sadder but wiser for this challenging experience. And today's announcement will create hundreds of new, safer spaces to serve our growing seniors population in the communities where they're needed the most, in the communities where their families, friends, and lives are. And thank you very much. And now we're going to hear from representatives of Alberta's continuing care community.
Good morning. My name is Jennifer McHugh, and I'm proud to serve as the board chair of the Alberta Continuing Care Association. On behalf of ACCA, I would like to thank Premier Kenney and Minister Shandro for including ACCA in today's announcement. We are very excited that the government is moving forward with its commitment to increase the number of continuing care spaces in Alberta to better address the needs of seniors across the province. Today's announcement will seek to provide priority communities with new publicly funded spaces without additional capital funding. The ACCA represents operators providing care and services for seniors across the continuum, including home care, supportive living, and long-term care. Our members operate nearly half of the continuing care spaces in Alberta. Every Albertan wants to age with grace and dignity, close to family and friends. Targeting communities most in need means that Albertans will have quicker access to continuing care closer to home. We recognize that the current economic challenges faced by Alberta requires a creative approach to increasing care spaces and addressing the risks associated with aging infrastructure in this province. And this is a smart and sensible approach that will benefit Alberta seniors and communities across the province as we face increasing seniors populations with very complex care needs. Having a continuing care system that provides safe, quality care and supports to Albertans through partnership with willing and committed nonprofit, faith-based and independent providers alongside their public counterparts just makes sense. The ACCA is thankful for the open dialogue with Alberta Health and Alberta Health Services. We look forward to continuing working with Minister Shandro to create the best possible sustainable continuing care industry. ensuring that all continuing care operations are funded equitably and sufficiently across the province. Better quality of life and care for Albertans in the safe and comfortable environments they so deserve, and better value to taxpayers can be achieved when we work together. Today's announcement is a welcome first step towards that goal, and the ACCA looks forward to continued collaboration through the future phases of this program.
Good morning. Good morning. I'm John Kopek. I'm the Vice Chair of the Christian Health Association, or CHAA for short. On behalf of CHAA's not-for-profit member organizations, I'd like to acknowledge our government's commitment to ensuring Albertans have access to a range of continuing care spaces and services. CHAA's members serve nearly 15,000 Albertans in more than half of all municipalities across the province. Having operated in Alberta since as far back as the late 1800s, our nonprofit organizations know firsthand how important it is to bring services to the people wherever they live across our many communities, towns, and cities. Whether residents need long-term care beds or community outreach services, it's essential that vulnerable Albertans have access to services close to home. Especially as health needs change over time, staying connected with loved ones, families and communities is, and always will be, a key to healthy aging in place. CHAA is proud to work in partnership with seniors in government. With 150 years of trusted service under our belt, we look forward to serving Alberta communities for many more generations to come. And thank you very much to our government.
Okay, before we get started with the Q&A, I'll remind those on the line to let us know who you're directing your question to. Operator, can you please put through the first caller?
Our first question comes from Chris Barco of the Calgary Herald. Your line is open.
Hi, this is a question for the Premier. Premier, this is a two-part question. I'm wondering, the province has taken on, I believe, an additional $1.2 billion provision on cancelling its crude by rail contract. And APMC has also posted a $1.9 billion loss, mainly due to a provision tied to the Northwest Sturgeon refinery. My first question is just, what is your government doing to minimize these losses? My second question is, with these two cases in mind, what are you doing to avoid a similar situation with your direct investment into Keystone XL? And what are the lessons that you should be learning, or Albertans will learn, from those two previous cases?
Thanks very much. First of all, on the crude by rail, that was a mistake that the previous government entered into. We opposed it from day one, and because we knew that was an area that the government should not be distorting the market, that the market would respond with incremental crude by rail shipments at the right price point. That's exactly what happened. In February of this year, we reached an historic high of 412,000 barrels per day of crude moving by rail out of Alberta without the operation of the NDP contract, which was for 120,000 barrels over 2 years for billions of dollars. And that's the reason we ran on a commitment to hand off those contracts. We had made great progress over the fall and winter in negotiating that. We had agreements in principle to reassign the 2-year crude by rail contracts to private sector operators at acceptable prices, which would have saved us hundreds of millions of dollars from what the NDP had encumbered us with. Unfortunately, before all of those negotiations could be novated, that is to say, the final legal work being completed, we hit the COVID crisis, and as you know, the greatest collapse in oil prices in history. And consequently, the rail economics really fell apart. I am pleased to say, however, that APMC, the Alberta Petroleum Marketing Corporation, has successfully transferred and novated contracts for about 50,000 of the 120,000, and they have a very credible plan to move the other 70,000. This was a write-down recognizing the liability that was incurred by the previous government. But let's be clear, if we hadn't sold these contracts, we would have been on the hook for even more. In fact, it's estimated that we would have been on the hook for at least $2.3 billion and as much as $2.7 billion. So we've at least been able to save taxpayers a few $100 million on this, but the whole deal never should have been struck in the first place. On the question of the Sturgeon refinery, you know that we've always had very serious concerns about that arrangement that dates back to over a decade. As you know, the project is years behind schedule, and it went at least 100% over the original estimated cost, $10.1 billion in capital costs. And I should point out that one of the legacy parties that are now constituted in the UCP was opposed to the Sturgeon refinery proposal in the very beginning because they were concerned that taxpayers were taking on too much risk. We've now seen that risk come home in a very substantial way with that write-down, that $1.7 billion provision in our fiscal update presented last Thursday by the Minister of Finance. Now, that is partly a reflection of current market conditions, and we do hope and expect that price will rebound post-COVID and the market conditions will improve, and that now that as of June 1st, the Northwest refinery is finally producing, we do hope that there will be some revenue flow from this that will mitigate the risk and the loss to taxpayers. But this is a bitter pill for sure. And let me just add this, Chris. You know, very often, and hardly a day goes by when people don't say to me on social media, why don't you build some refineries? Well, guess what? We did build a refinery. And it took us $10 billion in Alberta to build a refinery that's supposed to be producing 60,000 barrels per day. Let me put that in context. My colleague Prasad Pandit, Minister of Infrastructure, was a senior project engineer on the Reliance Jamnagar refinery in the west coast of India, the largest oil refinery on earth. And he tells me that they built the first phase of that to process 800,000 barrels a day for a little over $3 billion US. So 800,000 barrel capacity for a $3 billion capital investment versus 60,000 barrel capacity for diesel here on a $10 billion capital investment. That's one of the reasons why the private sector is not prepared to come forward with multi-billion-dollar investments for refineries here because of the cost structure for the future. We're for diversification, for upgrading wherever it makes sense, for facilitating private sector investment, for petrochemicals, but full-scale refineries are a very expensive and risky proposition, as underscored by last week's write-down.
Operator, can you please put through the next caller?
Our next question comes from Tom Vernon of Global News. Your line is open.
Hi, this is for the Premier. Thanks for taking my question. It was just about a week ago the Prime Minister announced funding for education across the country. We've not heard yet how Alberta intends to spend that money. Do you have any idea when that announcement will be coming and what areas that funding will be directed to?
Yes, Tom. The Minister of Education will be making that announcement tomorrow. We only received this offer from the federal government last week, and we have spent the time, the Minister of Education has been consulting with school boards and superintendents about how best to apply the $260 million over the next year or so. And so that announcement will be made tomorrow based on the consultations and the input that we've received from school boards and superintendents. I should point out that this will be in addition to the $120 million increase in operating grants to school boards that our government is providing in this school year, as well as the $250 million that we are investing in capital maintenance and renewal for our schools, much of which is specifically COVID related. And it's in addition to the $10 million in personal protective equipment that we are providing to schools across the province, including 1.7 million non-surgical masks. I'm pleased to report, at least I'm informed, that all of those masks have been delivered as of today to the schools, as well as thousands of liters of food-grade hand sanitizer as well. And that's also in addition to the Minister of Education allowing school boards to access some $35 million of their reserve funds to help pay for additional costs. So this additional money undoubtedly will be helpful, and that announcement will be made tomorrow.
Operator, can you please put through the next caller?
Our next question comes from James Keller of the Globe and Mail. Your line is open.
Hi, this is a message for the Premier, also on schools. We had several schools and even an entire board delay reopening due to cases detected among teachers and staff. It's only been 2 days. What do you think this foreshadows for the coming school year in terms of the potential for infections and disruptions, and can we expect any further significant measures to curb the spread in the province's schools?
Well, we've always said that there will be infections in the schools. It's inevitable given the reality of the viral spread. And that's why we've put in place a number of protocols based on the scientific advice of our Chief Medical Officer of Health in consultation with superintendents and school boards. We believe it's a strong plan, and we'll make future adjustments as necessary. We're all learning through this as we go. One thing I will underscore is that Dr. Hinshaw and her team, they did not come up with our guidelines arbitrarily or based on mere opinion. They did it based on a very close reading of the most up-to-date research and data coming from jurisdictions that have opened their schools. And that's what's informed their approach. And let me say that we would ask that school boards remember to please consult with the Alberta Health, with the Chief Medical Officer, on responding to positive cases or outbreaks. And she is going to look at each one of those on a case-by-case basis and make the appropriate judgment. So it's always been clear that there would be some outbreaks, and from time to time there will be classes or even schools that have to suspend operation for a while, but that should not the inevitability of that should not be a reason for us indefinitely to keep the schools closed. The colleges of pediatricians in both Canada and the United States, the associations, I should say, of pediatricians have been very clear that there are very significant negative health consequences and other consequences for kids if they cannot return to in-class instruction, including mental health challenges. And so I think it's essential that we get the schools open, assuming obviously a certain risk. As the College of Alberta School Superintendents has said, the reopening plan of Alberta Education clearly demonstrates a willingness to take the necessary steps to support the safety of staff and students, and they appreciate our continued collaboration and support. The president of the College of School Superintendents also said that they strongly believe that the reentry plan offers the appropriate balance of guidance from the Chief Medical Officer of Health and the government, while providing for the authority and autonomy for individual school divisions to assure their students, parents, and staff that a successful return to school will be safe. As Dr. Hinshaw herself said, as a parent of school-aged children, I've decided that the value of in-school learning outweighs the risks for my family, and that's why I'm sending my children back to school in September, as she said last week. So we'll continue to modify the protocols for the schools based on the scientific advice that we receive from the Chief Medical Officer.
Operator, can you please put through the next caller?
Our next question comes from Kevin Nimick of CTV. Your line is open.
Hi there, this is another question for the Premier. Many parents and teachers are expressing confusion and frustration over the Chief Medical Officer of Health now stating 2 meters of distance would not be mandated in classrooms. Many parents decided to send their kids to school with the understanding that there would be distance between desks. So why isn't your government, in conjunction with Dr. Hinshaw, clearly communicating with constituents, and why are you allowing relaxed safety measures?
Well, we are clearly communicating, and we're not allowing relaxed safety measures. The medical order issued by Dr. Hinshaw on the weekend perfectly reflected the policy that she outlined a month ago. So we were the first province in Canada, I believe, to provide specific guidelines for the safe reentry of schools. That announcement was made on August 4th with respect to masks, for example. And this week's update of the public health order was simply giving schools the legal authority to enforce the mask requirement that was announced on August the 4th. So I know that the teachers union has tried to create some confusion about this. That's regrettable. But as Dr. Hinshaw, our Chief Medical Officer for Health, clearly outlined yesterday, this is a confirmation of what was announced over a month ago.
Okay, we have time for 3 more. Operator, could you please put through the next caller?
Our next question comes from Terry Reith of CBC. Your line is open.
Yes, hi, thank you. My question is also for the Premier, and it is actually a direct follow to that last question. We have seen strong public reaction to Public Health Order 33/2020. Some might say a backlash. What concerns do you have, Mr. Premier, with trust around the Chief Medical Officer of Health at this point in time?
I think it's unfortunate that some political actors are trying constantly to score political points against our highly qualified public servants in the midst of a pandemic. That's truly regrettable. But let's be absolutely clear. The Order 33 is simply the legal confirmation of the policy that Dr. Hinshaw announced a month ago. Plain and simple. It's unfortunate that some people are trying to create controversy where none should exist. This is just the legal reflection of the policy that was announced a month ago. And by the way, it's broadly the same policy that exists in other jurisdictions all across North America with respect to the reopening of schools. Alberta's plan is broadly similar to that of other provinces. I know that there are folks trying to exploit this entire pandemic for their own purposes. The NDP proposed, for example, that we only reopen the schools if we can create class sizes of 15, which would require opening 13,000 new classes, building 800 new schools, training and certifying 13,000 new teachers at an estimated cost of $4 billion. That's not a plan to reopen the schools. It's a plan to keep them shut. So I trust the expert science-based advice that we receive from the Chief Medical Officer and her team of public health experts. And let me point out that this has been confirmed by many experts. Dr. Stephen Friedman, a professor of pediatrics and emergency medicine at the University of Calgary, wrote that I'm looking at this from a global level. So when you ask the question, how safe is COVID-19 for kids? In the grand scheme of things, it's very safe. Children rarely have complications when they're infected with COVID. Dr. Joan Robinson, Director of Pediatric Infectious Diseases at the University of Alberta's Faculty of Medicine, wrote that, quotes, parents should be reassured that unless their child has a severe chronic medical problem, it's very unlikely that the child would require hospitalization if infected, assuming that household members do not have severe medical problems and that contact with the elderly is avoided. It should be safe for children to return to school. The social and educational benefits from return to school would be predicted to far outweigh the risk of COVID-19 for the vast majority of Alberta children. And let me point out what the American Academy of Pediatrics have said, that the importance of in-person learning is well documented, and there's already evidence on the negative impacts on children because of school closures in the spring of 2020. Lengthy time away from school and associated interruption of support services often results in social isolation, making it difficult for schools to identify and address important learning deficits, as well as child and adolescent physical and sexual abuse, substance abuse, depression, and suicidal ideation. This, in turn, places children and adolescents at considerable risk of morbidity and, in some cases, mortality. These are the views of the experts, and this is why we have followed the scientific, evidence-based advice of our Chief Medical Officer and her team. With respect to Order 33, it was simply a legal confirmation of the policy that was announced on August the 4th that empowers school boards to enforce the masking requirement for children from over grade 4 in crowded common areas where they're not seated in the classroom. So again, I think it's regrettable that some people, at least one union and at least one political party, have been trying to create confusion where none should exist about the simple confirmation of a decision that was made a month ago.
Operator, can you please put through the next caller?
Our next question comes from Lisa Johnson of Post Media. Your line is open. Hi, this question is also for the Premier regarding the school reopening as well. I'm wondering if in this announcement tomorrow, a lot of Albertans are concerned about where the federal funding towards safe school reopening is going to go. And I'm wondering if you can confirm that any of it will go towards reducing class sizes or new initiatives. And I'm wondering if you can also comment about what does this say about the school plan that Alberta had that the federal government felt it necessary to step in with $262 million.
Well, the federal government did that for the entire country, not for one province alone. And that's their prerogative. I guess they decided to add this on to the Safe Restart Agreement as sort of an addendum after that had been negotiated last month. With respect to the details, those will be announced by Minister LaGrange tomorrow. She is completing consultations with the school boards and superintendents today. And let me say, we appreciate the cooperation of school boards and superintendents in developing the Alberta principles for the safe reentry of schools. And let me also say that the same concerns that are being raised here are being raised in every other province and in every other jurisdiction around the world. And we are trying to learn from those experiences of schools that did reopen earlier. It's on that evidence that the Chief Medical Officer of Health developed her advice to the government. So again, the announcement will be made by Minister LaGrange tomorrow. But one thing we know is when you ask if that will be used to decrease class size, we estimate that reducing class sizes in half would cost about $4 billion. Here we're talking about $260 million from the federal government. So that is 1/15 of the estimated cost of reducing class sizes in half. So that just gives you a scale of the proposals to reduce class sizes in half are actually proposals to keep the schools shut. Because even if we had infinite money, and by the way, let me say, this really is not about money, because I've said to our ministers from the beginning, if we need additional resources to ensure safe reentry of schools, we'll make those resources available. Our government has not skimped on fiscal action to ensure people's safety through the pandemic. To the contrary, as our fiscal update pointed out last week, we have put forward $14 billion of fiscal action over the past 6 months in response to the COVID crisis, $3 to $4 billion of which has dealt directly with public health measures, including additional funding for our hospitals, additional funding for long-term care and continuing care, personal protective equipment, and so much more. So we have spent billions of dollars to help to protect Albertans from the novel coronavirus. We'll continue to spend as required. We appreciate the additional federal funding. But there is no world in which you could reduce class sizes in half and reopen the schools for the current school year. You'd have to build 800 new schools and certify 13,000 new teachers. It's simply fictitious. It has nothing to do with reality.
Okay, we have time for one more. Operator, can you please put through the last caller?
Our final question for today is Audrey Nouveau of Radio Canada. Your line is open.
Thank you very much. I have two questions about the continuing care. My first question is for Mrs. McHugh and Mr. Kopech. In your opinion, how many more beds could that create in your facilities, and how many more staff do you think you would need to service these additional beds? And I have another question also for Premier Kenney in French this time. Monsieur Kenney, pourquoi est-ce que vous avez favorisé un système de paris? Pourquoi est-ce que, selon vous, ça a plus de chances de fonctionner que de simplement demander aux opérateurs de soins de longue durée de créer plus de lits dans ces espaces sous-utilisés que vous avez déjà identifiés?
Okay. Well, thank you. I'll take the first question, actually. So we know that it's actually going to be at least hundreds of beds in this first phase of the new ASLE 2.0, as it were. So it's going to be at least hundreds, but until we actually do get the submissions for the proponents for this request for expressions of interest, we won't know the extent to which we can add new spaces. So at least hundreds at this point, but we don't have a specific number at this point until we get those submissions. For the second question, did you guys get the second question? I didn't either. Do you mind repeating the second question? That was for me. That was the second one?
The one about the staff?
Sorry, what is about which?
The second one. I asked how many more staff do you think you would need? And I asked also to Mr. Kenney if he could answer also in French, but you can also answer in English. Why a bedding system? Why would that be more efficient than just directly asking these operators to build these beds in these already targeted underutilized spaces?
Thank you. So the additional staff will also depend on not just how many more folks are going to be making submissions and are successful in making those submissions, but also how many, because we aren't going to know the mix of DSL or designated supportive living submissions we're going to receive as opposed to long-term care submissions. So once we do receive those submissions, then we'll know how many additional staff are going to be required. And Premier?
Do you want to answer that second question in English? The last question in English?
Oh, sorry, and then because it was for you, Premier, do you mind then the last question that was meant for Premier? Do you mind repeating that one more time? Do we lose her?
Why aren't we just asking them to transfer these into public?
Choose a bedding system. Why would that be more efficient than directly asking the operators to just build more beds in these underutilized spaces?
Well, so a couple of things. So right now in our continuing care spaces, we have about 80% of our beds are either going to be nonprofits, private partners. All of those independent providers are doing those 80% of our beds, and 20% are AHS beds that are also providing the mostly long-term care, but also some DSL through AHS. So right now, what we're doing with the ASLI grant, this first phase of it is the non-capital part of it. We will be making an announcement in the future related to capital announcements. So a second phase of ASLI that will include a capital component, so we can also build new beds as well throughout the system. So that is part of what's included in Budget 2020. We'll be making that announcement soon. At this point, though, we're very happy to announce this first phase of ASLI 2.0, as it were, to have the requests for expressions of interest from those for the non-capital part, this first phase. And then we'll also be announcing there's actually going to be a refurbishment phase as well as an Indigenous stream, which we're going to be very happy to be announcing. So the ASLI announcements that are coming later on in the year, we're very proud of. But at this point, we're starting off with phase one, which is the non-capital part.
Je vais essayer de le faire en français, mais c'est un vocabulaire particulier. Alors, aujourd'hui, nous annonçons un processus pour créer plus d'espace pour les aînés subventionnés par le gouvernement dans les maisons d'âge d'or. Maintenant, il y a beaucoup d'espace disponible qui n'est pas utilisé pour le soin subventionné par le gouvernement. Alors, le point de l'annonce aujourd'hui est de faire et d'attirer les expressions d'intérêt des opérateurs qui ont l'espace typiquement dans les édifices du secteur privé et à but non lucratif pour voir où il y a un cas pour subventionner le soin des aînés par Alberta Health Services. Alors, c'est vraiment, c'est pas tout simplement pour le gouvernement de faire une obligation de modifier les chambres qui sont disponibles aux chambres subventionnées pour les services du gouvernement. Il faut évidemment voir les demandes et des opérateurs et pour s'assurer un équilibre de disponibilité de soins pour les aînés de façon équitable, particulièrement dans les villes prioritaires, parce qu'il y a certaines villes, particulièrement dans les régions rurales, où il n'y a pas, les communautés rurales, où il n'y a pas assez d'espace pour les aînés. Souvent, il faut dire que les personnes âgées doivent déménager de leur communauté aux grandes villes pour avoir accès aux services fournis par le gouvernement. Et pour nous, ça serait beaucoup plus juste pour leurs soins, pour les personnes âgées, d'avoir la capacité de rester dans leur communauté avec les services de Alberta Health. J'espère que ça répondu à votre question. Thanks very much, everyone.